Hello, my name is Laura Cruz, and I'm the Director of Benefits Access at Senior Resources Agency on Aging, located in Norwich, Connecticut. From here on out, we're known as the AAAs. Our AAA serves Eastern Connecticut, which includes Middlesex, New London, and Wyndham counties, and a few towns in the Tolland County area. AAA is a private nonprofit organization designed by the state to address the needs and concerns of all older persons at the regional and local levels. Many of the programs offered are funded through the Administration for Community Living and overseen by the State of Connecticut Bureau of Aging Services. You can reach us locally by calling our local number of 860-887-3561, or you can email at us at our general email box, which is seniorinfo@seniorresourcesec.org. The AAAs provide more than just Medicare counseling services. So basically, what we say is if you have an aging question or a caregiver concern and are not sure where to turn to, call your local AAA. Chances are we have some answers that we can provide to you. Quick little word about my colleagues over at the SMP program, the Senior Medicare Patrol. A word about scams in relation to Medicare. Billions of taxpayer dollars are lost annually due to improper claim submission. This program helps prevent, detect, and report healthcare fraud, errors, and abuse. You can do your part in identifying these types of issues by reading your Medicare statements that you receive through either the original Medicare program, it would be called your Medicare Summary Notice, your MSN, or if you're enrolled in a Medicare Advantage plan and or a prescription drug plan, you will receive a statement called the Explanation of Benefits, the EOB. These statements show what was billed to the Medicare program on your behalf. And if you see items and services that you know you did not receive, then you should report it to your local SMP program. And the SMP program is co-located in 4 out of the 5 agencies on aging in Connecticut. You can reach by calling the hotline at 1-800-994-9422. Now, the reason why you are probably listening to this presentation is every state has what's known as a State Health Insurance Assistance Program, known as SHIP, SHIP. And each state typically will rename their program. And in Connecticut, they have opted to name their SHIP program Choices. So Choices is not an insurance plan. What it is, it's a program that has trained counselors that provide free, unbiased Medicare counseling to all older adults and persons with disabilities. We help you to understand your Medicare coverage and the healthcare options that you have and when to enroll into them. We screen you for Medicare cost savings programs because as we go through this presentation, you're going to find out that there are many financial obligations that you will have as a Medicare beneficiary. We help provide enrollment assistance with Medicare Advantage plans or Medicare prescription drug plans. And this program is funded by the Administration for Community Living and administered by the State of Connecticut Bureau of Aging. Just a key point here is Choices counselors. We are not insurance agents or brokers or financial planners. Therefore, we do not gain financially from your decision. The bottom line is we are here to tell you all about the Medicare program, the options, and what to do to avoid enrollment penalties at a later time. This presentation is really good for those that are turning 65 soon. If you're going to work beyond the age of 65, or if you're under the age of 65 collecting what's known as Social Security disability benefits. So this is just meant as an overall presentation. You're probably still going to have a lot of questions about the Medicare program. So we would really encourage you to reach out to the Choices program to receive one-on-one counseling assistance. And you can get that done either by telephone, by a virtual appointment, or in-person appointments, but they do need to be scheduled. The Medicare program is the federal health insurance program for people who are 65 years of age or older. Or if you're under 65, you might have gone through the Social Security disability process and been determined disabled, and you begin to collect what's known as SSDI, Social Security Disability Insurance. After you collect that for 2 years, you will then become eligible for Medicare. And it's also available to any person who's been diagnosed with end-stage renal disease, which is kidney failure that is resulting in the need of dialysis or perhaps a kidney transplant. I'm going to be throwing around a lot of acronyms about the Medicare program, but I kind of wanted to get you used to some of the acronyms that I'm going to be talking about and what they mean. So, when it comes to Medicare, Medicare has four parts. When Medicare first became available in 1966, you only had Medicare Part A, which is your hospital insurance, and Medicare Part B, which is your medical insurance. That is known today as Original Medicare. So you'll hear me say a lot about the Original Medicare program. I'm talking about your hospital and medical insurance. But over the years, other parts to Medicare were added onto the program. Medicare Part C, as in Charlie, is a type of health plan offered by private insurance companies. And Medicare Part D is a Medicare prescription drug plan. But in a little bit later in this presentation, I will be discussing each part of Medicare in depth, so you will know exactly what you're looking at to enroll into. Before we do that, though, I do want to talk briefly about the enrollment period, those who are going to be automatically enrolled, those that need to act to enroll yourself into Original Medicare, and then we'll talk a little bit about the options that you have. So if you are collecting a Social Security benefit, remember you can collect Social Security as early as age 62, or you might be collecting Social Security disability because you can no longer work. If you are already collecting, basically one of those sources is you will be automatically enrolled into Medicare when your time comes. So about 3 months before the month of your 65th birthday, be on the lookout. You will receive not only your Medicare card, and that's what it looks like on the screen, you'll also receive a little booklet. It's basically this presentation condensed into about 10 or 15 pages or so. If you're collecting Social Security disability, about 3 months before your 2-year mark of collecting that disability check, you will be automatically enrolled into Medicare. From there, you do need to decide if it's something you need to keep or can you delay pieces of Medicare because you might be enrolled in what's known as an active employer group health plan. Just a key words, though, or some pointers about this package that you will be receiving. Please be very careful because it almost looks like junk mail. I've seen the envelopes that these packages come in, and there's really not a lot of information. But if you see the emblem down here at the middle bottom of your screen, that emblem that looks like an eagle, it says Department of Health and Human Services. That is Medicare. So the outside of the envelope doesn't state Medicare. Be on the lookout for anything that has that eagle because that is true and accurate Medicare information coming your way. And it usually contains your Medicare card along with the little booklet that I was talking to you about. Some of you, though, might need to act and enroll yourself into the Medicare program when you are turning 65. So if you are not collecting a monthly Social Security benefit and you know you need to enroll into Medicare because basically you're not covered under an employer group health plan coverage, it is up to you to enroll. They're not going to let you know it's your time to do so. It is up to you to act and get yourself enrolled into both Medicare Parts A and B, and then you'll have to figure out everything else after that. So you want to do this about 3 months before the month you turn 65. The quickest and easiest way and the preferred method, of course, is signing up online. So if you do receive this presentation emailed to you, we can do that. You'd be able to click right on the link. But effectively, the only agency that enrolls you into the Medicare program originally, into both Parts A and B, is the Social Security Administration. So you can go to ssa.gov/Medicare/sign-up. That begins the process. It is not the portal to start collecting your Social Security benefit. That is a personal decision that only you can make. We will not counsel you on whether you should collect your Social Security benefit or not. You and only know your financial situation. So you might want to delay your collecting a Social Security benefit because maybe your full retirement age isn't until 67. The issue is the enrollment to enroll into Medicare for the very first time did not graduate like the full retirement benefits for Social Security. So that is your decision to make. So, as I said, the quickest way is signing up directly online. You can make an appointment at your local Social Security office if because if you don't have a computer or it might be a little hard for you to do so, just let the Social Security office know that you cannot do it online for whatever reason, and that you truly need an appointment to sit down with a Social Security representative to file your application for both Medicare Parts A and B. Or last but not my favorite by any means, is calling the nationwide Social Security number at 1-800-772-1213. Either way you do this, especially if you're talking to somebody, whether it's at your local Social Security office or the nationwide telephone number, do make sure you take meticulous notes. Jot down the date and the time and the telephone number that you called and to the person to whom you spoke to. If there's any way to get some form of a confirmation from the person you're speaking to, please do so. You want to be able to create your paper trail just to prove in the event it takes a little bit longer to get you enrolled, you have some form of confirmation on the date and time that you did this in the event that somebody else needs to kind of step in for you and help you if we can to connect with Social Security to say, hey, this person did enroll into Medicare but has yet to receive anything. But depending on your situation, and I've kind of alluded to it a few times, you may or may not need to enroll now into Medicare. You could consider delaying your enrollment, but it's for very particular situations. So let's talk about those that have to enroll into Medicare or take their Medicare if you're automatically enrolled, and it's due to certain circumstances. So if you have no other health insurance based on active employment, active is the key word, not retirement. So if you're retired, you're not actively working. But if either you or your spouse who might be covering you with the health insurance, you might be able to delay enrolling into Medicare. So the key words is having a health insurance based on active employment. If you do not have active employment group health plan coverage, you might be enrolled in what's known as Husky D, as in David. That means you went through Access Health Connecticut, you inputted your monthly income information, and it might qualify you for Medicaid for adults between the ages of 18 to 64, not eligible yet for Medicare. If you are enrolled in Husky D, you have to take Medicare when it becomes available to you. And if you also enrolled in a qualified health plan, you might be receiving premium tax credits or whatnot. But if you are enrolled in a qualified health plan through Access Health Connecticut, you are also a person that must take Medicare when it becomes available to you. And what you will need to do is about 2 weeks prior to the month of your 65th birthday, you'll need to connect with your Access Health Connecticut qualified health plan to let them know that you are turning 65 next month. And as of that day, you are now eligible for Medicare, so they can terminate that policy for you. Typically, the qualified health plans will not let you know that you're turning 65, and it is up to you to ensure that you are terminating your policy when Medicare becomes available to you. But for some, you might be able to delay enrolling into Medicare. And as I said on the left-hand side of the screen, if you have health insurance based on active employment. So again, it could be you who's employed, it could be your spouse who's employed who carries you on their insurance. But there's certain limits here, caveat to this that you really need to know about. So if you are 65 and going on to Medicare, in order for you to delay enrolling into Medicare, there needs to be at least 20 or more employees through the organization that carries your health insurance. If there's less than 20 employees, then you have to take Medicare. Medicare will be primary, and you'll need to decipher if your employer group health plan will keep you on as secondary. If you are collecting Medicare due to being disabled, that means you've been collecting Social Security disability for 2 years. So on the 25th month, you become eligible for Medicare. Remember, you'll be automatically enrolled. You'll need to decide if you need to keep Medicare or not. If you might be working, or it could be your spouse who's working, there needs to be more than 100 employees in order to delay taking Medicare Part B, as in boy, your medical insurance. If there's less than 100 employees, then you have to keep Medicare. It's possible that maybe that employer might be secondary for you. So again, having a conversation with the Human Resources Department might be in your future if any one of these scenarios affect you. I am going to briefly talk about health savings accounts and how you need to be very careful with those when it comes to Medicare enrollment. So health savings account, the acronym is HSA. HSAs are not health insurance plans, but it's an option to help save pre-tax dollars to those with a high deductible health insurance plan. So the IRS defines who can get an HSA. So they tell you that in order to get an HSA, you have to be covered under a high deductible health plan. You cannot have any other health insurance coverage active, and you cannot be enrolled in Medicare at all, Medicare Parts A or B. So when you come to talk to Choices, we have a lot of questions that we're going to ask you. But typically, as a Choices counselor, we say, go ahead and enroll into Medicare Part A. For most of you, it's premium free, helps get your foot in the door. It makes signing up for Medicare Part B during a special enrollment period so much easier. But one of our questions that we're going to ask you is, but do you have right now, are you contributing to an HSA and not collecting Social Security benefits? If the answers to those are yes, then we're going to encourage you not to take Medicare Parts A and B and do not collect Social Security until you're ready to collect, because you're going to have to stop contributions in a timely manner. And it might be up to 6 months before your Medicare enrollment. So if you are actively working or your spouse is actively working and you're contributing to an HSA, pre-planning is going to be very important for you because unfortunately, if it is determined when you go file your taxes that you're enrolled in Medicare, but yet you're still contributing to an HSA, you're going to face IRS tax penalties. So we'd rather have you seek more guidance from Choices about this, but also too, if you don't mind perusing the internet, you could Google what you would want to type in is the National Council on Aging, HSA, and Medicare. Again, if you receive this presentation electronically sent to you, you can click on that HSA and Medicare link. It's a really helpful guide to basically help you decide when you need to stop contributions so you're not penalized by the IRS because it can happen. Okay, so now let's really discuss the initial enrollment period because it is the most important enrollment period of all the Medicare enrollment periods that they have. Because especially if you're the person who has to act, meaning you have to enroll yourself into both Medicare Parts A and B because you're not collecting Social Security. Excuse me. So your initial enrollment period begins the 3 months before the month you turn 65, or you can also replace this, the month of your 65, with the 25th month of collecting Social Security disability. So it's very important 3 months before the month of your Medicare eligibility that you review all the options available to you. You decide that, okay, do I need Medicare or do I not need Medicare, and make those decisions. It is the time to review it all, because if things are not done within this initial enrollment period and you fail to enroll into the parts of Medicare that you need, you will be facing late enrollment premium penalties at a later time, and you might be without coverage for some time. So hence the reasons why we really need you to understand the initial enrollment period. So it begins 3 months before the month of your eligibility. You still have the month of your eligibility to enroll into Medicare Parts A and B if you need to. And then you still have the following 3 months after the month of your 65th birthday to enroll into both Medicare Parts A and B. Remember, if you're collecting Social Security disability or you've already been collecting Social Security prior to, chances are you've automatically been enrolled into both Parts A and B and you have your red, white, and card. During this time, especially the 3 months before the month of your eligibility, that's when you need to get all your homework done. You need to determine, one, do I need Medicare? If you do decide that you need Medicare, then you need to figure out, how do I want to get my Medicare coverage? And again, just a few more slides, I'll be discussing the options that you have because you'll need to decide if you want to stick with the original Medicare program or if you're going to enroll yourself into a Medicare Advantage plan. So do make sure you get all your homework done. You ask all the questions that you need. Get all the enrollments that you need done within that first 3 months before the month of your eligibility. Therefore, the month you become eligible, you are ready to go. It means you have everything in place on day one in the event that you need medical services. You can still wait for the month that you turn 65 or the following 3 months after you turn 65. The issue that you'll need to know is that your medical insurance, Part B, is going to be delayed by at least 1 month. So it's possible you may have no medical coverage for that month, and I want you to avoid that. So please do your homework 3 months prior to the month of your 65th birthday. If you chose to delay taking Medicare Part B because you are actively employed and you had health insurance based on that active employer, remember the 20 employee mark. If it pertains to you, then you might have decided to delay Part B. A lot of folks do because you have to pay for Medicare Part B. There is a monthly premium for it. But if you do decide to delay, you are going to be given what's called a special enrollment period to enroll into Medicare Part B after your employer group health plan coverage ends. Remember, active employer group health plan coverage. You have 8 months to do so once that happens. We're not going to suggest that you wait the full 8 months because if you have no other health insurance in place, you might be without medical benefits. You can either enroll into Medicare Part B anytime you're still actively working, or you can enroll into Medicare Part B once you know that you're going to retire and you need your Medicare to start. So you have that 8 month to do that, to get it all done. That sounds wonderful. I will tell you though, 8 months goes by very quickly. And again, I would never encourage anyone to wait the full 8 months. Now, this pertains to Medicare Part B only. You still need a prescription drug plan in place within 63 days of losing your employer group health plan coverage. So basically, you have to do an enrollment into a prescription drug plan within at least 2 months of once you decide to retire and your employer group health plan coverage ends. I don't know why these two enrollment periods don't coincide with one another. I can't answer that. But I just want you to plan accordingly because if you are going to retire, especially if you have more notice than not, you want to get everything squared away for you. So therefore, the month that you are retiring, more than likely your employer group health plan coverage is going to end at the end of that month to begin with. You know you want all your Medicare programs to start on the first of the following month. And again, it would be going through the Social Security Administration to file for Medicare Part B during a special enrollment period. Again, plan accordingly because there are forms that you're going to have to get back from your soon to be former Human Resources Department. So please don't delay and connect with choices well before that. You can go online through ssa.gov to look for the forms that you're going to need. The Choices program also downloaded those forms directly from Social Security, and we can provide that to you as well and give you more one-on-one guidance on how to enroll into Medicare Part B during your special enrollment period, and of course, help you with all the other options that you have as well. So moving on to basically, I talked a lot about coverage options. You know, you either need to stick with Medicare Part A or Medicare Part B2, or maybe you want to get your health insurance through what's known as a Medicare Advantage plan. So that's what we're going to go ahead and review next. But I do want to give just a quick warning to those that might be retired, and part of your retiree system is you might be given a retirement health plan that wraps around your Medicare coverage. So one of the myriads of questions that we're going to ask you is, okay, I hear that you're retiring. Through your former employer, are you going to get a retirement health plan? Like, are you a former state of Connecticut retiree? Maybe a teacher retiree? Any other company as part of their retirement package provides you health insurance. Are you one of them? Because you might not want to do anything at this point. You'll need to enroll into both Parts A and B, but I don't want you listening to all the commercials that you see on TV. Because if you have a retirement health plan that wraps around your Medicare Parts A and B, and if you choose to go off on your own or listen to a neighbor because this neighbor says they get this, this, and this with their health plan, you're going to unravel the retirement package that you have, and your employer will kick you off that retiree health plan. There is no law that states they have to take you back. So you might have worked at an entity for an extremely long time, and you might have just thrown away everything by enrolling into something that you saw on TV, not realizing that it was going to remove you from your employer retirement plan. And like I said, I've worked with some individuals who the employer plan will not allow you back in. I've worked with some individuals where the employer was good and said, yes, show us the proof that you terminated that plan and we'll let you back in. So please be very mindful and educate yourself if you are a retiree from an organization and part of a benefit is they give you a health insurance plan that wraps around Medicare. It is up to you to understand the ins and outs of the plan and to know that if I leave it, I may never be able to get it back again. But of course, Medicare is just so clear sometimes, it gets a little complex. There are some retirement plans that say it's okay for you to have other parts of Medicare that you can enroll in other parts of Medicare, like an additional prescription drug plan or a Medicare Advantage plan. And those are individuals who have retired from the federal government, which also includes TRICARE for life. If you're a military retiree, you also have these options to add. Many folks don't, but I just wanted to let you know that that's the one case in point and where a person could add on to their retirees, their plans, add on more. Okay, so now let's talk about two different options. So again, if you're not retired, this next section is for you. So if you're not active with any retiree health insurance, you're either going to want to stick with option one, which is the original Medicare program. That's Medicare Parts A and B. So that's your hospital insurance, that's your medical benefits. You also need to add on a prescription drug plan, and you may want to consider adding on a Medigap policy. Or we will talk about option number two, where you may choose to enroll yourself into a Medicare health plan that will have your hospital benefits, your medical benefits, and a prescription drug plan wrapped into them. So let's discuss right now option one. Medicare Part A is your inpatient hospital care. This is when a doctor writes an official order to admit you into the hospital. The hospital needs to accept assignment, which basically means they accept what Medicare pays. They're a provider for the Medicare program. And there is typically a utilization review committee that's going to approve your stay while you're there. So they're basically going to go over your record with a fine-tooth comb and say that, yes, due to the reasons why you need to be admitted, within reason, they do feel that Medicare is going to pay for your hospital stay. If you had a 3-day inpatient stay, which means you have to be there 3 full days, not counting the day of discharge, so let's just use the fact that if you were admitted on Monday, you have to stay Monday night, Tuesday night, Wednesday night, come Thursday. If you were discharged to a skilled nursing facility, Medicare will pay for short stays at a skilled nursing facility to help you rehabilitate. There's certain criteria that you need to meet, which is basically daily skilled care. Medicare Part A, upon discharge, it will also help cover for some home health care. In order for you to access it, you need to be homebound, not bedbound, but homebound. You do need skilled care on a part-time or intermittent basis. You have to be under the care of a healthcare provider. You do need to have a face-to-face encounter with that doctor. So that could have been done at the hospital, could have been done at the skilled nursing facility. Maybe once you were discharged, you went and saw your community doctor. Regardless, you have to have that face-to-face appointment with your healthcare provider. That doctor has to order those services, and it needs to be provided by a home healthcare agency that accepts Medicare. Usually your doctor's office takes care of all that for you, so you don't have to try to figure out what home health agency participates with Medicare. They'll usually send the referral out to the home care agency, and that home care agency will connect with you to start up the services. And last but not least, under Medicare Part A, hospice care is covered. Hospice care is a special way of caring for somebody who's nearing the end of life because they're terminally ill. You do have to elect it. It's not automatically given to you. You have to physically say, yes, I want hospice care. Your doctor does need to certify that you're terminally ill. And if the disease, illness, injury runs its course, the doctor basically needs to state that in the event this happens, you have 6 months or less to live. It does require a face-to-face encounter with your healthcare provider. And again, the doctor needs to order the services, and it needs to be provided through a hospice facility that that accepts Medicare assignment. Now, costs. Medicare Part A premium. Most individuals do not owe a Part A premium because through your work history, you have paid into the Medicare program. So as long as you've worked 40 or more quarters in your lifetime, which is 10 years of full-time work, you've paid into the Medicare program. If you have less than 40 quarters, you are going to pay some form of a premium. If you do not have a large work history, Social Security will screen to see if maybe you can collect off your spouse if you're married or deceased spouse. They will screen for those certain circumstances. But if it comes to find out that there's not enough work history to qualify for premium-free Part A, you can elect to enroll into Part A, but you are going to have a premium for it. If you have only 31 to 39 quarters of work history, Part A for 2026 will be about $311 per month. If you have less than 30 quarters of work history, Medicare Part A will cost you roughly $565 per month. But this does not affect a lot of Medicare beneficiaries in Connecticut. There's very few that do not qualify for premium-free Part A. But everybody does have a hospital deductible. And in 2026, the per benefit, now that is in red, because I want you to understand that that can happen more than one time per year. Okay, so it's not a yearly deductible, it's a per benefit deductible. And this year it's $1,736. Medicare will cover the first 60 days at no additional charge, but if you do need additional inpatient hospital days, Medicare will still cover them, but they are going to offset some of the financial liability over to you. So if you're still in the hospital and you reach day 61, days 61 through 90, you're going to have a $434 per day copay. Typically, that is when your benefit period ends. So if you still have some lifetime reserve hospital days, you can tap into those. But in the event you've utilized all your hospital days, Medicare Part A ceases to pay. So you'll have to find some other alternative way of paying for hospital care. And what we usually say is if you're choosing original Medicare, you definitely want to pick up a Medigap policy to help offset these costs. So you don't owe them, your secondary insurance will pay them for you. If you had that 3-day stay and you went into the skilled nursing facility, Medicare covers the first 20 days at no additional charge. There's no additional deductible to meet. It's first dollar coverage the day you get into the skilled nursing facility. Again, short-term stays though. So for the first 20 days are covered 100%, but days 21 through 100, if you still need daily skilled care, Medicare is going to cover a big bulk of those skilled nursing facility days, but they are going to offset some of the liability over to you. And in 2026, that would be $217 per day for days 21 through 100. Again, I hope you have purchased a Medigap policy to help pick up those balances. Great news, though, is your home health care, care that you receive inside your home that is approved by Medicare. There are no copays for those services. So if you need a visiting nurse to come in and see you, that's great. It's covered 100%. You're not expected to make any form of a copay to have those services inside your home. Hospice care, you pay nothing for care, but you might have up to a $5 copay per pain medication to help manage your pain. And in very, very, very small circumstances, you might qualify for inpatient respite care for up to 5 days to give your caregiver a break. If you do access inpatient respite care, you will owe 5% of the inpatient stay that you have. Again, I do hope you have a Medigap policy in place that will help pick those balances up. So again, my last point on this screen is it's suggested to purchase a Medigap policy. Give me a few more screens and I'll talk to you a little bit more about what a Medigap policy is. Medicare Part B, that's your medical insurance. That's what you're going to utilize more than likely the most. This is your physician services, whether you're inpatient or outpatient in the hospital. You do get access to many preventative healthcare benefits, including a Welcome to Medicare exam. You can access that within the first 12 months of obtaining Medicare Part B coverage. After 12 months of being on Medicare Part B, you can then have a yearly wellness exam. These are not physicals by any means. They're short quick appointments with your healthcare provider to come up with a game plan on treating whatever conditions you have now, but also trying to keep you healthy ongoing. And each year you can come back and review that game plan you two have put together. Outpatient diagnostic testing, imaging, durable medical equipment, prosthetic devices, and in some cases, very limited ambulance services. Medicare does not pay for routine transportation. It's only going to pay for a situation in where you need to access care ASAP or else you might be in very big trouble. So if you have to call 911, Medicare will come and transport you to the closest hospital for care, but Medicare is not going to pay because you have to go visit your community doctor. It's just unfortunately, there's just some gaps in the Medicare program. So a lot of times it's easier to say what Medicare Part B does not cover. And these are things that are routine in nature. So routine dental care. There's very limited dental coverage. But basically anything routine, if you need teeth cleanings, if you need teeth extractions, root canals, dentures, Medicare doesn't touch that at all. So you might need to purchase other insurance to help offset those costs, or you'll have to pay out of pocket. Routine vision, if your eyes are healthy as can be, and then you're just having a routine eye exam to prescribe glasses because you cannot see near or far, Medicare doesn't touch that. However, if you have a medical issue, don't take this as you won't ever be able to get an eye exam done. If you have a medical issue like macular degeneration, glaucoma, cataracts, that is a medical issue. Therefore, Medicare will pay for you to have those eye exams done. But as way as getting eyeglasses to be able to see, Medicare will only pay for standard frames with standard lenses after you had cataract surgery where a lens was replaced. Other than that, Medicare doesn't touch eyeglasses at all. And hearing aids. Medicare will pay for you to have a hearing exam done to see if you need hearing aids, but that's where they stop. There's zero coverage at all for a pair of hearing aids, and not even for the fitting exam in order to have those hearing aids fitted. So those top three bulleted points here is you're either going to need to pay out of pocket or maybe you can purchase additional insurance to help offset those costs that you have to pay for those. And last but not least, as I mentioned several times, long-term care. Long-term care is not covered by the Medicare program. And once Medicare ceases to pay, you have to have some other form of a payment readily available in order to continue to stay at a skilled nursing facility or any other subsequent days as an inpatient in the hospital. So that's the unfortunate bad parts about the Medicare program. Now, for Part B, everybody owes a premium. Doesn't matter how many quarters you've worked in your lifetime, everybody pays a premium if you want your medical insurance to happen. So in 2026, the base premium is $202.90. That comes directly out of your Social Security benefit if you're collecting. If you're not collecting Social Security, you will have to make it a point to pay that on a monthly basis. You'll typically start getting a quarterly statement from the Medicare Premium Collection Center. Once you get that statement, you will have to pay about 3 months worth of Part B premiums. From there, you can set it up to pay on a monthly nature, whether it's automatically deducted from your account or you can go online and pay directly through Medicare.gov. Now, unfortunately, if you are a higher earner, you will pay more for your Part B, your medical insurance, and Part D, your prescription drug plan. When you enroll into Medicare, Social Security does review your tax return, and they review the tax return from 2 years ago. So since we're in 2026, any new individuals going on to Medicare, Social Security will review your 2024 tax return. If it is decided that if you were a single filer and you earned more than $109,000 in 2024, you're going to pay a higher Part B and a higher Part D premium. If you're married and your joint income shows that you earned more than $218,000 in 2024, same thing, you'll pay a higher Part B and a higher Part D. There are ways, if you don't agree with that decision, maybe you had a lot of assets that were cashed in that were taxable and it just upped your income that one year. There are ways to connect with the Social Security Administration to appeal that decision. And of course, there's forms to fill out. If you need that form, we can send it to you, or you can get it directly through the Social Security Administration. But they are the determining factor. We at Choices, we don't determine that for you. You would have to go through their appeals process to get that rectified. Um, Unlike Part A, where there is a per benefit deductible, Part B, there's a calendar, a yearly deductible. So once it's met for the year. You won't have to worry about re-meeting it again until the following year. And for this year, it's $283. So before Medicare Part B, for items and services that are not preventative, Medicare will not pay the first $283 worth of your medical care. But once that is met, Medicare then pays 80% of the contracted rate. Therefore, you would get a bill for 20% unless you have a Medigap plan that will pick up that 20% for you. So I said a lot about considering to enroll into a Medigap plan. We definitely suggest it. It's not mandatory, it's not required, but we do suggest it because of the fact that Medicare Parts A and B doesn't cover 100%. There's those deductibles and copays and coinsurances that are usually your responsibility to pay. Now, the plans range in premium and coverage. What we mean by that is there's multiple Medigap plans that are available out there. Some of them cover a lot of your Part A and Part B deductibles, copays, and coinsurances. Some of them cover not so much of those because it's more in a high deductible nature. To make plan comparison easy, all the plans are standardized. Now, they're standardized by a letter, which kind of makes it confusing because there's a Medigap A, there's a Medigap B. The most common ones that you're probably going to look at is a Medigap Plan G as in girl, or a Medigap Plan N as in Nancy. Those are very two comprehensive Medigap plans that offer a lot of coverage, but of course their premium pricing might be a little bit higher. If you don't have a lot of medical expenses, you could look at a high deductible Medigap plan in which the premium would be very low, but keep in mind it's a high deductible plan. So if you do go into the hospital and a skilled nursing facility, basically you know you're going to be on the hook for your Part A deductible and some of your Part A copays at the skilled nursing facility if you incur them, because your secondary plan has a high deductible. You'll still have to meet that. In Connecticut, plans are community rated, not age rated. That just means it doesn't matter whether you're 65 or whether you're 95. Let's just say you and your neighbor across the street, you're 65, your neighbor's 95. You sign up for Medigap Plan G through whatever company. They have the same exact plan through the same exact company. You're both are going to pay the same premium. Your neighbor who is 85 or 95 isn't going to pay higher because he or she is older. So that's a nice thing in Connecticut. The other nice thing that Connecticut has that a lot of other states do not have is your Medigap plan. It has a continuous enrollment period. So that means there are certain insurance companies that sell Medigap plans where their premiums increase in premiums go into effect June 1st. So you could be plugging along through a year or so, and then all of a sudden, come May, you're getting a letter from your Medigap carrier that says they're increasing your premiums. A lot of times this time of year, we get a lot of phone calls from folks saying, my insurance company just said they're raising my premiums. They can't do that. Should they have done that January 1st? The answer is no. It basically depends on when they signed their contracts with the state of Connecticut. And it's quite possible that the premium increases can happen midway through the year. So basically what I'm just trying to say is that if you're in a Medigap plan and they increase the premiums too large for you, you can review the other plans that are available to you and enroll into something else. So that's really good. Now, again, if you get an electronic version of this, you can see the choices program is underlined. You can click on that and it should bring you up to the most recent, what we call a Medigap rate sheet, where Choices has listed all the insurance carriers that can sell a Medigap plan in Connecticut, along with the standard plans they offer, as well as the premium pricing that is current at the time of the printing of that document. So definitely review that. And of course, After this presentation, if you still need assistance with your Medicare information, please call Choices. We'd love to chit chat a little bit more with you about all the different options that you have. Now, you're not quite finished with option one. You still need to consider adding on a Medicare prescription drug plan. So what that means is a Part D plan. That is additional insurance. It's a separate insurance to purchase to help cover drugs at the pharmacy counter. So while Medicare says enrolling into a Medicare Part D plan is voluntary, they also let you know that if you don't sign up for a drug plan when you're first eligible and you have no other creditable drug plan in place, and then decide later in life to enroll into a Medicare prescription drug plan, you are going to be penalized. So if you're just going to roll the dice and say, I don't take any drugs, why should I have to sign up for a drug plan and pay for it? I get it. I truly do. My next sentence to you is going to be, if you choose not to take a Part D plan when you were first eligible and you have no other drug coverage, you are going to be penalized. So our suggestion is sign up for at least the cheapest plan that's out there so it covers you in Medicare's eyes to show that you have a drug plan. Some of you may not need to enroll into a drug plan because you have some other form of a creditable drug plan. So if you are a veteran and you go through the VA and you get your drugs through the VA, great. That's a creditable drug plan. You don't have to have a Medicare prescription drug plan if you don't want one. Any form of a credible retiree drug plan, like I said, if you're a state of Connecticut retiree, teacher retiree, maybe you retired from your municipality through the town that you worked for, you want to find out if your retiree health plan offers what's known as a creditable drug plan. And of course, if you have TRICARE for life or if you're a federal retiree, what you have through them is considered creditable. Now, Medicare Part D, unfortunately, is not free. Everybody owes some form of a premium for a prescription drug plan. In 2026, there's only 11 plans available, so there's not much to choose from, and they range in premiums. The cheapest one is $8.40 per month per person. The most expensive is I'm just going to round up, $239 per month per person. A lot of the plans have a calendar year drug deductible. Very few plans have no drug deductible whatsoever. Many of the plans do. And in 2026, it can be as high as $615. After the drug deductible is met, you will have some form of a copay or a coinsurance per covered drug that you take up to a certain amount of money. So in 2026, there's a cap of $2,100. Between your calendar year deductible and your copays and coinsurances for your covered drugs, if you happen to pay $2,100, you're then covered 100% for your drugs for the rest of the calendar year. So good news on the forefront for that. Bad news is, as I discussed with your Medicare Part B premium, if you are the higher earner, not only does it affect Part B, it does affect your Part D plan as well. If you're in that situation, you will receive a notice from your drug plan that you enrolled into that it has been determined that you're a higher earner. So on top of this premium, you're now going to have to pay extra. And that goes directly to the plan itself, the drug plan. Unlike Part B, the extra goes to Social Security. Your prescription drug plan goes directly to the drug plan that you have. Now, how do you determine the best plan for you? Those 11 plans that are out there, how do you determine what's best for you? This is where Choices really comes into play because we can help you navigate this. Or if you're computer savvy, you like perusing the internet, go to Medicare.gov. This is where we do all of our work at. If you go to Medicare.gov, you're looking at the main screen. Towards the bottom of the screen, you're going to see a tab that says Find Health and Drug Plans. Click on that and follow the screens that it's telling you the information they're going to need. You need to have a list of your prescriptions readily available, the dosage, which means how many milligrams that drug may be, how many times per day do you take it, and you want to know, how do you get your medications? Are they 30-day supplies or are they 90-day supplies? And of course, I would suggest that you add 2 or 3 different pharmacies to this mix, because you'd be amazed on how much money you can save by switching from one pharmacy with one plan. I have seen upwards to a person saving a couple $100 per year just by switching to a different pharmacy with whatever drug plan they're enrolling into. There's things you need to consider. Now, I want you to keep this screen in mind under things to consider when I talk about the Medicare Advantage plan. And you'll see why when I get there in just a couple minutes. So, things that you need to consider when reviewing the drug portion. You want to know, are all your prescriptions that you take covered on the plan? Are there restrictions, such as do you need prior authorization or step therapy with whatever drugs that you take? Can you go to the pharmacy of your choice? Like I said, adding in 2 or 3 different pharmacies is going to give you that overall view of, okay, I like this plan because I can get my drugs at this cost. But if I go to the pharmacy I really want to go to, it increases my drug costs exponentially. So that is why we want you to enter in at least 2 to 3 different pharmacies. And basically, the bottom line is, how much are my prescriptions going to cost for the rest of the calendar year? The software system gives you a month by month, but it also gives you an estimated between the premium, the deductible, and the drugs that you're taking. It's going to give you an approximate figure of what it's going to cost you for the rest of the calendar year. So it is a way to make financial decisions, kind of have somewhat of an idea of how much money do you need to set aside to help pay for your prescription drugs. And again, like I said, choices, this is what we do all day long. We're very happy to help you screen the different prescription drug plans that are out there. And this is the gateway that we utilize to help you enroll into that plan. You can do that on your own as well. So if you're on Medicare.gov, you went through the Plan Finder tool, you reviewed that, okay, this plan sounds, just fine for me, and you want to go ahead and do the enrollment because you're within a valid enrollment period, go ahead and do so. You can do it. And in about 10 business days, you'll receive communication from the prescription drug plan that you enrolled into. And hopefully that communication will contain your new card and the effective date of when you can start using that prescription drug plan. Okay, the other option that you have. So let's go to option number 2, Medicare Advantage plans. So Medicare Advantage plans, these are private health plans that are approved by the Centers for Medicare and Medicaid Services, CMS. They're the holder of the Medicare program. It's just another way to get your Medicare benefits. You're still part of the Medicare program, which means you still must continue to pay your Part B premium. You can't get away from that because basically what's going to happen is CMS is going to transfer your hospital and medical coverage over to the private health insurance plan that you chose to enroll into so they can start providing you all your care. So that's why you still need to be part of the Medicare program and still continue to pay your Part B premium. But these Medicare Advantage plans are sold and administered by private insurance companies. So now instead of Medicare having the say so about your care is going to be directed under that private insurer. And when it comes time to maybe needing CAT scans, MRIs, it's up to that private insurance plan to either approve or deny you being able to get, say, that CAT scan that you might need. You can't go through the original Medicare program to get any of your services any longer. Now, what makes these very advantageous is these types of plans, by law, they have to cover everything original Medicare covers. So hospital, medical, durable medical equipment, preventative care, diagnostic imaging, ambulance services. Anything original Medicare covers, they have to do so also. But they have the flexibility of adding on additional services that Medicare wouldn't touch at all. So do you remember me talking about routine dental, vision, or hearing? How original Medicare doesn't pay for that at all? You might find certain Medicare Advantage plans that may offer some coverage for that. It's not fabulous, but it's something. So you might find a Medicare Advantage plan that has some form of a supplemental benefit that will help provide some dental coverage, some hearing coverage, and some vision coverage. They might also offer other benefits too, such as an over-the-counter program, which means their OTC benefit that might allow you each quarter to purchase things like Band-Aids or Motrin or Tylenol from their little booklet that they have. It's usually a set amount of dollars and it's, use it or some of them are lose it. A lot of times those don't add. If you try to wait a half a year, A lot of those plans do not roll over the benefit. So a lot of times it's a use it or lose it. And some of these Medicare Advantage plans may offer a gym membership as part of their wellness package. So this may come in the forms of, say, silver sneakers. So if you have a local gym in your area that participates with silver sneakers, you might get a free gym membership through your Medicare Advantage plan. And the last caveat to this that makes it advantageous is your Part D prescription drug plan is included with that Medicare Advantage plan. So if you know you need a drug plan, you want to sign up for a Medicare Advantage plan that covers your prescription drugs, that has the Part D built into it, because you cannot sign up for a standalone drug plan if you choose to go to a Medicare Advantage plan route. So it's one or the other. You can't mix the both. You either have option one or you have option two. If you choose option two, Medicare Advantage plan, please make sure you are signing up for a Medicare Advantage plan that your drug coverage is built into it. So let's talk a little bit about some of the disadvantages when it comes to the Medicare Advantage plans. Is one, still got to pay your Part B premium. Second, some of these plans may require you to pay an additional health plan and or drug plan premium to the plan that you choose to enroll into. Some of the plans may require you to pay extra for those extra benefits, an additional premium, like the dental piece. In order for you to get comprehensive dental, you might have to pay for a dental rider, which is extra money that would come out of your pocket to pay the plan. You want to check to see if the plan you're enrolling into is in-network coverage only, which means all doctors and hospitals and facilities you use must be in the network in order to be covered. You may not have any coverage for out-of-network health care doctors or facilities. So please educate yourself before you enroll into any of these plans. You need to read and understand your financial obligation to all costs relating to this plan and your healthcare needs. So you want to review, what are your doctor's services going to cost you? Do you have a PCP visit copay? Do you have a specialist visit copay? What are they? If you were unfortunately ever admitted into the hospital, do you have a deductible that you need to meet? What is the per day copay after the deductible is met that you have to pay? Diagnostic imaging. Sometimes big ticketed items like MRIs or CAT scans, you may have up to, say, or more, a $250 copay. So you want to read and understand that, because you cannot purchase a Medigap policy to offset those costs. It's one or the other. So if you're in a Medicare Advantage plan, you are liable for everything the plan says is your responsibility. So how do you know what that plan will charge you for certain services? Again, go directly to the Medicare.gov website. You click on that button that says Find Health and Drug Plans. You go through the screens, ensuring that you're selecting Medicare Part C when you want to review the plans, and you can go through in detail all the plans that are available. By county, they vary. Some counties have about 28 different Medicare Advantage plans. Some counties have about 31. So depending on what county you're from, you have a lot of options to review. Also, the plan's website is a good source to find out other information. I utilize this a lot when I'm counseling individuals who want to enroll into particular Medicare Advantage plans. I download a plan document called the Summary of Benefits. It's a great tool. Not only does Medicare.gov have good information, the Summary of Benefits takes it one step further, because if you're really interested in knowing, the dental portion, how much money do I have? How much money do they cover in dental coverage? Whereas the Medicare.gov doesn't really tell you too much about that. So you want to do some of that homework on your own. So the Summary of Benefits is a great place to start. You can also download the evidence of coverage for that plan. Don't print it out because they're about 300 pages long, but that is really a really big, in-depth overview of the plan that you might be choosing to enroll into, and gets into the nitty-gritty about the plan. So if you have a specific area of concern, maybe you are a diabetic and you need to get certain diabetes testing supplies, review that before you sign up with a Medicare Advantage plan, because you have to review where that Medicare Advantage plan will allow you to go to get your diabetes testing supplies. Okay. Again, choices is here. We're very happy to review some of the benefits with you as well. And again, Medicare.gov, when you're reviewing the Medicare Advantage plans, do make sure you're reviewing the drug component and making sure that all your drugs are covered, and what are your approximate out-of-pocket costs going to be with that. And then you can also enroll into that Medicare Advantage plan directly through the Medicare.gov portal. If you're working with someone, that's perfectly okay. You can work with maybe that insurance agent or broker that's helping you. Just make sure you are satisfied with all your questions before you enroll into that plan. And do make sure you get some form of a confirmation that you did enroll into that plan prior to leaving the office appointment that you may have with that person. Now, I'm usually asked, okay, well, once I make a decision, is it mine for eternity? And the answer is no. You are given options to revisit the plans that are available and to make changes. So the biggest enrollment that is out there is the annual enrollment period. Every October 15th to December 7th, anybody who's actively enrolled in Medicare and has to choose their own benefits, whether it's a drug plan or a Medicare Advantage plan. Again, not really for retirees, but for those that have to make their own decision, you have the annual enrollment period. You can do a lot of things during this period. You can switch drug plans, you can switch Medicare Advantage plans, you can go from a drug plan to a Medicare Advantage plan, you can go from a Medicare Advantage plan back into original Medicare. Lots of things that you can do. Once you make a decision, you have to enroll into the new plan that you want to enroll into. And as long as that's done by December 7th, the new plan will begin January 1st. One other enrollment opportunity that I wanted to present to you is each and every year, there's also a Medicare Advantage plan open enrollment period. This is where you have to be enrolled in a Medicare Advantage plan going into the new year. And you're limited to what you can do during this time period. You can either switch from one Medicare Advantage plan to a different Medicare Advantage plan, or you can leave the Medicare Advantage plan and return back to original Medicare, and you should enroll into just a standalone prescription drug plan. When you do decide to do that and the enrollment is done, the new plan will begin on the first of the following month of enrollment. Once April 1st comes, you're out of enrollment periods. So unless you qualify for some form of Medicaid assistance, whatever decision you made is your decision, and it needs to last you for the rest of the calendar year. Now, we're just about almost done. I'm going to end my presentation with talking about some of Connecticut's financial assistance programs when it comes to Medicare. Medicare is not free. You heard that all throughout this presentation. There's things like premiums, deductible, and copays. If you qualify in Connecticut, there are ways to help make Medicare affordable. Number one, the Medicare savings programs. There's 3 different levels to this program, and it's based on your income. So what you see on the screen is the highest income you can earn each month. And as long as you're below that, you might qualify for one of the 3 levels of the program. So all 3 levels pay your monthly Medicare Part B premium. So that $202.90 that's coming out of your Social Security benefit, the state of Connecticut will pay that on your behalf. Depending on the most comprehensive level that's out there, and you don't see that here on the screen, you would end up getting a Gray Connect card where it could act as your secondary insurance. But the bottom line is, if you're just looking to get your Part B premium paid for, as of March 1st, 2026, these income limits are effective through February of next year. If you are a single individual, your gross monthly income, if it's at or below $3,272, you may want to check this program out. If you're married and your combined income is $4,437, if it's at or below that, you may want to check this program out. Because again, it just really does help you save money. Just Part B premiums alone, it's well over, I believe, $2,000 for the year that you would end up saving. So that's a good, chunk of change. What I also like about this program is once you're approved for one of the 3 levels, you're going to be automatically qualified and enrolled into what's called the Low Income Subsidy Program. LIS, also known as extra help. You don't have to do an additional application. It's going to be done for you automatically behind the scenes. So, what the LIS does is it will reduce the cost of your covered prescription drug plans to no more than $12.65 per medication. It will help pay the Medicare Part D deductible. So, as I said, a lot of the plans do have a calendar year deductible, and it can be upwards to $615. If you are enrolled into the LIS program, the LIS will pay that deductible on your behalf. You will only pay no more than the $12.65 per med. And it will help you pay a premium towards your prescription drug plan. So, whether you have a standalone drug plan or if you're enrolled into a Medicare Advantage plan with drug coverage and there's a drug plan premium, you're going to get some help there. It might pay it in full, or you may have a partial premium that is due. So definitely check this program out, connect with Choices. We can give you all the information that you need. We can help you apply and re-explain the program more in depth, especially if we can kind of help determine what level we feel that the Connecticut Department of Social Services will approve you for. You know, your agencies on aging, your AAAs, we're all nonprofit organizations, and we do rely on volunteers a lot to help do all the work we do because there's very limited staff to be able to provide the education and assistance that's needed. So this program, Choices, we do host new trainings every year for those that may want to take on this volunteer opportunity to help learn more about Medicare yourself, but you're wanting to provide help others learn more about Medicare. So if you're thinking that this is a good volunteer opportunity for you, please reach out to your local area agency on aging. We'd be happy to chit chat with you about the trainings and what it entails, the time commitment that's needed, and all those wonderful things. But we're always seeking candidates too to become members of our board of directors that manage the Area Agency on Aging and the advisory council that helps advise the board about areas of need where we need to focus on and legislatively. So if you're looking to make a difference in your community and you live in Eastern Connecticut, please give us a call. We would love to be able to chit chat to you about the volunteer opportunities we have and if you want to become part of a great team. And I will leave you with this. Again, this is how to connect with the Choices program. You can, if you're in Eastern Connecticut, you can call our local office at 887-3561, and you'll want extension 202. If you're in the state of Connecticut, not listed in one of these counties, you can call the Choices hotline number of the 1-800-994-9422. It should connect you to the area agency on aging that serves the area that you live in. And of course, you can email us. I already at the beginning of the presentation listed our general email box, but if you want to email me directly at ljcruz@seniorresourcesec.org, I would love to hear from you and be able to help you with the questions and concerns that you have. And that's about it. That's what I have for you. I hope you took a lot from this presentation. And again, the takeaway from this is please note, call us. That's what we're here for. We're to help you navigate this complex system of Medicare enrollment and options. And we're here just to bounce ideas off of as well. All right, take care. Thank you so much, and we'll talk to you later.